Okay. Good morning, Marsha.
Hi, Ev. How you doing?
Good, good. I just wanted to go over with you a few things about the laboratory values and what have you.
All right.
I think I understand everything and I understand my prescriptions.
Okay.
The first thing, when I looked at my laboratory values, I noticed that the hematocrit and hemoglobin were down a bit, which is not surprising with this complicated surgery. Also noticed that the patient's PTT was 30 seconds. It's a little high.
Is he on a medication?
Heparin.
Okay, gotcha.
And because the patient now has developed an ileus and had been vomiting and has an NG tube, I noticed that the total protein and albumin are down as a result, and the potassium,
What's normal potassium?
3.5 to 5.5. And I noticed that it's in the intravenous at
Good.
75
Yep,
an
you're
hour.
right.
The other thing I noticed that was off a bit was the BUN and the osmolality. Patient's a little dehydrated, not surprising because the protein level's down.
Okay. Do you have any questions about anything?
No, what I'm going to do is start my vital signs first and assessments and line reconciliation, and I'll start from here and I'll start swiping.
Okay, go ahead.
Hi Adrian, my name is Evie and I'm going to do your lab skills exam today. And I'm going to put your bed up so I can reach you a little bit better. I'm going to take a look at all of your lines and reconcile them to make sure everything is okay. So I've noticed here that the NG tube is intact, going to low intermittent suction, draining kind of a bilious green material. I noticed also that the patient has the prescribed SCDs on, heels off the bed, and the Foley catheter seems to be draining kind of a light yellow urine right now, about 50 mLs, no twisting of the catheter tubing. Also notice that the patient has a Jackson Pratt, which will need to be emptied shortly. And then the IV site here, what I'm going to check as well is to make sure that the IV that's prescribed is running. 5% dextrose, has sodium chloride, 20 of KCl. Yes, and then I'm also going to check the patient's ID band. This is Adrian White, and Adrian was born 5/1/50.
Yep, correct.
Okay, great, great.
Nice.
All right. And for safety purposes, I'd have Adrian as well, state their name and date of birth.
Yep.
And I think the IV site looked good here. No swelling, no drainage, and I'm going to check for a little blood return by just occluding the tubing, and I see a little flashback.
Okay. All right. What do you want to do next?
I'm going to do vital signs on the patient.
Okay.
Okay? Vital signs you'll be doing on your faculty member. Okay? Except for the blood pressure, the respiratory rate, it's the temp, the SpO2, and a Doppler. If you have to do a Doppler, you're going to do it on your faculty member. Okay? So Marsha, here we go. Under your tongue. 97.6. Normal. I'm going to do your saturation. Come. Just slow.
Okay.
99%. Good.
Yep, you're good.
I'm going to do the radial pulse. I'm going to do it for 30 seconds. It's nice and regular. I got 98.
Okay, correct.
I'm going to listen for the respiratory rate over the chest area. 30 seconds. 16.
Okay, all your vital signs are correct.
I got a
Good
blood
job.
pressure just to do next, and then we'll get her. Okay. I'm just going to pump this up to 160 because I know that I can't palpate this.
Right.
Okay. (100/60).
Correct. Okay, good job.
All right.
What do you want to do next?
I think I'm going to do my priority assessments, and based on this particular patient's scenario, I'm going to do breath sounds because of the COPD, and then I'm also going to be doing bowel tones to see if, with the Reglan the patient was on earlier, it's been prescribed in the NG tube, that there may be a resumption of bowel activity.
Okay.
So I'm going to start with the bowel tones, and I'm going to start down here in the left lower quadrant. I hear absolutely no bowel tones, so I'd have to listen 3 to 5 minutes to conclude that they're absolutely absent.
Okay.
I'm going to work up. Again, the same, nothing at all, so I'd have to listen 3 to 5 seconds. 3 to 5 minutes, I'm sorry. Same, absolutely absent. I'd have to listen 3 to 5 minutes. In all 4 quadrants, there's no bowel activity.
Okay, good.
I also noticed that the abdomen's a little distended. I'm not going to palpate at all or percuss because of the patient's surgical intervention.
Nice.
The next thing I'm going to do is I'm going to do breath sounds. And on these mannequins, we only listen anterior. I hear a little expiratory wheezing bilaterally.
Why do you think?
Because of the patient's COPD, perhaps.
Okay. Okay, so those are your priority assessments.
Yeah.
What would you like to do next?
I think what I'm going to do next is I'm going to change the IV rate.
Okay.
Okay. Is it okay that I leave my head bed up?
Yeah, you can leave the bed up because you're
Okay.
in the room.
All right.
Just not the side of
Okay.
us have to be.
Okay. So my prescription over here, which I'm going to bring with me, the computer system I notice has gone down in this hospital.
Yes, it has.
So that's why paper, thank gosh we have paper. So 100 per hour, so I'm going to A, and I'm going to change it to 100, okay, and start.
Why do you think they increased the IV?
Because the potassium's still a little low, and the patient's dehydrated.
Yeah, good.
Yeah.
Good.
All right. Now what I'm going to do next, I think, is irrigate the Salem sump tube
Okay.
to make sure to establish patency. There we go. I got out a new catheter tip syringe this morning and dated it.
Okay.
And labeled it. Oh, system's back up.
I'm trying to figure it out. Let's see if I can find
Okay. First thing that I'm going to do is check placement, and at this particular hospital, we're doing pH.
it. Okay.
Actually, just do this like this. Just trying to find my. I should have had 2 chucks, but it's okay. All right. So what I'm going to do is I'm going to take my syringe, and I am going to shut it off to the patient. Then I'm going to put my syringe in and off to the exit and pull back and get some aspirin. and clamp it back off. Okay. And now what I'm going to do is I'm going to test this gastric aspirate. And it appears that I have a 3.
Okay.
Anything under 4 is in the gastric